Hi, welcome to another Lifestyle of Eden podcast. I'm your host, Nick Tognietti, and today I have a returning guest who has been a mentor of mine and is very well known in the field, Dr. Carrie Jones. Dr. Carrie, thank you for joining me once again.
Nick, thank you so much for having me back.
Well, if you've been listening to my podcast, then you know Dr. Carrie. If just follow her on Instagram, she's got hundreds of thousands of people that are viewing her stuff daily. But she's a hormone specialist. She is a menopause whisperer, all things women. She is just a master at. She's great at stuff with men, but she really, has become so known with all things women in the menopausal. I would say almost epidemic, not in the sense that menopause is an epidemic, but I feel like the way that women are treated or addressed in
Yeah.
those seasons can be. So she's a wealth of knowledge. She also has her own podcast. Her information has been completely loaded up on how to watch her podcast, get to her page, and all of that within my pages. So anyway, today I'm excited because anytime I get Dr. Carrie's ear or attention, I love to hear her just unload on hormones. So, Dr. Carrie, what I want to discuss today, like the title says for the viewers, is synthetic hormones versus bioidentical. And the reason this got brought up to me was for me, I've I mean, for over 10 years since I've been dealing with hormones, I've always known that, the difference between bioidentical or synthetic. Like that was never a new thing to me. But there were some people that are in my mentorships and in my university that whenever I mentioned this to them, because they're in the bodybuilding world, so they're getting
hmm
things off the street, right? And so I had mentioned to them, I go, hey, this and this and this is off. I go, I'm going to be honest with you. This could be because what they're taking is synthetic.
Right.
And they said, what do you mean? Testosterone. And they completely thought everything was bioidentical in that sense. And I go, no, synthetic and bioidentical are completely different. I go, they respond differently. It takes more effort for the body to make it, bioavailable and stuff like that. So I was completely ignorant that a lot of the world is ignorant of
hmm
the two. And so I'd love to hear your history on how you came about each of them, where you use each one. Do you even use both, or do you just stick to BHRT? Some of the differences for the audience, things like that.
Like you said, so the synthetic is the kind that doesn't look like what's in your body, but it binds to those receptors and it actually does a whole lot of things depending on which hormone it is that we actually don't even know. So for example, the synthetic version of estrogen, which is Premarin, we actually can't make a generic of it because we don't know all the metabolites that it breaks down to and all the things that it does in the body. So let me back up. We have hormones in our body. We have estradiol, we have estriol, estrone, we have testosterone, we have progesterone, DHEA. Doesn't matter, male or female, we all have these hormones in our body. So we call those bio or body identical when we make them in a lab, but they look exactly the same. If I were to hold up a testosterone that you secreted versus a testosterone that's actually bioidentical testosterone, it should look same. That way it does the same thing in the body. When we talk about synthetic, as I said, synthetic are also lab created, but they are in some cases like close enough. They kind of look their ability to bind to the receptor, but because they also create other breakdown products known as metabolites, they can do other things in the body. We call them synthetic. So in the estrogen world, and this is where people are really shocked to find out because they're like, "Oh, I don't believe in hormones. I don't do hormones. I'm scared of hormones. Hormones cause cancer." Usually people are under the impression that's because they're synthetic and they've been heard that, synthetic all the time is bad. When really we have a lot of bioidentical options in estrogen, progesterone, testosterone, DHEA, and then we have some options for synthetic. Now, the most common synthetic everyone's probably aware of is the birth control pill. The estrogen form and then progestin form are both synthetic that are in the birth control pill. In the progestin IUD, if you have a Mirena or a Liletta or Skyla, Kylena, that is a synthetic form of progesterone known as a progestin. So we can definitely get into the weeds of what are the available options for each hormone that's bioidentical, when for sure would I use the synthetic. And I do, like I mentioned, I have patients that have an IUD and that's their preferred choice. I have women that love the birth control pill, that need the birth control pill. There is the progestin that's called Provera. That is a synthetic progestin, and it is an option in menopause. It is a synthetic progesterone option in menopause. It's not as common, of course, as it used to be for research reasons. It's the one that slightly bumped the increase for breast cancer risk in the study.
That's what I was going to ask was with the progestins, from the stuff I've learned from you and your menopause classes as well, and some literatures that came out, was that the synthetic forms of this were actually quite a bit higher in the percentages of causing cancer and whatnot.
No,
Not,
not quite a bit higher. That's actually been really blown out of proportion. So it is a slight increase in breast cancer risk. The average breast cancer risk of women, no hormone whatsoever, right? Like we have an average breast cancer risk. So, like, let's say out of 1,000 women, 7 are going to develop breast cancer, independent of hormones. If you add in a progestin, a combination of estrogen and progestin, it increases 3 to 4 more. So, like 7+3 or 7+4. So, it is not a massive percentage, but it was made to seem that way in the news back in the day. I'm not
yeah.
saying that's good. Don't get me wrong. I'm not saying, we love 3 to 4 more women with breast cancer, but it is not like 30 to 40 more.
Well, so let me ask you this and see if this would be somewhat of an equivalent like breakdown for the audience to understand. So when it comes to like iron, you have heme and non-heme. Heme is really only found for the most part in animal products. Plant-based doesn't really have heme. We have iron there, but not necessarily heme. Well, phase one detox is very dependent for the liver on heme. And so for people who are plant-based, the ones who are eating non-heme iron, they have to convert that into heme, which you can do. The body can actually do through different cofactors to develop that, but it makes it harder on the body. And sometimes you're efficient in it and sometimes you're not. Is that very similar to kind of the synthetic bioidentical, where synthetic can still be used, but the body has to do different things to allow it to be more bioidentical for the body, or bioavailable, should I say?
It'll never be bioidentical. So if you are
Right.
taking a progestin, Provera, the birth control pill, it will never be converted in the body to something that's bioidentical, but it may activate and create issues that you weren't otherwise anticipating. The list of side effects is quite a bit longer. It still has to go through detoxification, just like estrogen does, or progesterone does, or testosterone does, but
Yeah.
its list of side effects are definitely a little bigger and a little longer.
So where are the times that well, because you had said something earlier, your exact words weren't, "Hey, my client is on this synthetic I wanted." You said it was what she chose. So is this, and how you didn't say it was what you chose. So my question is, when do you, as a doctor, say, "Hey, I would prefer the synthetic over the bioidentical"? Is that ever a preference for you, or is it more?
Yeah. Yeah. So Provera is the synthetic progestin, and it's medroxyprogesterone acetate. And it is probably one of our fastest ways to reverse endometrial or uterine hyperplasia. What that means is if a woman is on estrogen or has a lot of estrogen, and what we call it is unopposed estrogen, and it's causing thickening, thickening, thickening in the inside of her uterus in the inner layer. If it goes rogue, it can become something called hyperplasia. And if the hyperplasia progresses enough, God forbid, it can become uterine cancer or endometrial cancer. So if you go get an ultrasound and they say to you, oh gosh, it's thick in there, we have to do a biopsy, and the biopsy comes back as hyperplasia, then Provera very quickly, most of the time, can reverse it. People will argue with me, well, why don't you just recommend progesterone? And I'm like, because I don't want them to very quickly develop uterine cancer. And if I know Provera in a couple of months can probably reverse it back to normal tissue, then I am willing to take the hit for those couple of months and have them do Provera. That's probably the only time that I use Provera, that progestin. However, I will say that I absolutely have women that have tried estrogen. They have tried the patch, they've tried the cream, they've tried vaginal, and they've hated all of it. But they do love the synthetic estrogen. It just works better for their body. I've seen it in the Reddit boards, I've seen it in the DMs and comments where women go, I've tried all of that, so I'm going to do Premarin. I did Premarin and I like that better. It is a synthetic estrogen. It is the one, Premarin's name is shortened because it's pregnant mare urine, but it doesn't increase the risk of breast cancer. So if I have that one woman who's like, Carrie, I've tried them all, I love my Premarin, I'm like, all right, let's stay on your Premarin. Fine.
I got you. So with the Provera, not only scientifically but anecdotally, you know that it's been to work incredibly at opposing that excess estrogen so it can prevent the cancer. Do you go to that over the progesterone because we know the progesterone won't work? Or is it just because we don't have enough data like we do with the Provera to prove that it does work?
The Provera has all the metabolites that seem to work really, really fast, and progesterone just doesn't have that. It doesn't mean they weren't on progesterone. I've absolutely had women on progesterone. And for whatever reason, even with progesterone, they still developed hyperplasia and progesterone just wasn't cutting it. And so Provera is what we suggest to reverse. Now, that can be an oral Provera capsule, or they may, depending which level of hyperplasia they have, their doctor may suggest, let's do an IUD. Let's do an IUD for like 6 months to a year, get that hyperplasia to reverse and protect your uterus. And so that's one time that I tend to use Provera if I'm going to use it. Every other time when I need a progesterone, I use progesterone. I just use real bioidentical
Right.
progesterone. Whether I'm using estrogen or not, like progesterone is the thing that I'm going for. Now, that's different than somebody who says, I don't want to get pregnant. I want some form of birth control, or they're on the birth control pill, or they're on the progestin IUD and they're happy with it. Then, that's their decision. They love it and I support it.
No, that's actually very helpful. I want to come back to the testosterone from the at the beginning in a
Yeah.
moment to discuss for men and women, but when as far as that the estrogen cases that you've talked about, the hyperplasia and
Mm,
endometrial cancer and things of that nature, or endometriosis, or that whole realm of just unopposed estrogen and the
right.
issues it causes from a functional root cause perspective, like, hey, in the acute term, yeah, this progestin or the Provera, okay, or you said Provera, not progestin, sorry, but
Same.
um, from the from the functional and root cause perspective, did you notice from a let's prevent this from ever happening or prevent it from coming back? Did they have cortisol issues, excess inflammation causing more aromatization, liver detox
Probably.
issues? Like there was probably a lot of root cause scenarios that were off.
Most of my cases of hyperplasia came to me with hyperplasia. Like they came to me wanting a consult, or they'd been working with somebody else, were having symptoms, and then came to me and said, hey, I'm a new person and I'm having these symptoms. Because when somebody is on estrogen and they have a uterus, I put them on the appropriate dose of progesterone. And like you, I'm doing all the things for detoxification and supporting the other foundations of health. So I can't actually remember a patient of mine who that didn't work and they developed hyperplasia. I believe all the cases of hyperplasia that I've had, or even uterine cancer for that matter, have come to me for like a second opinion, or hey, I'm having these weird symptoms. I'd like a second opinion. Do you think I need to go get a biopsy and an ultrasound? I'm like, yes, you do. You don't have a choice. And then
Yeah.
sure enough, we found it. So I didn't have management of their care leading up to that point. Now, I can tell you, just as you said, like what increases a woman's risk for hyperplasia? It's that unopposed estrogen. So, coupled with probably poor detoxification pathways and lots of inflammation in that area. So, some women will maybe they don't like their progesterone, so they go on estrogen. They're having hot flashes and joint pain and brain fog. They go on estrogen. They also go on progesterone to protect the uterus, and it also helps with other symptoms. But maybe they don't like it. Maybe they're
Yeah.
like, I hate this progesterone. I'm just not going to take it because nobody taught them. Like, hey, you actually have to because you have a uterus, and here's what we're protecting. So now they're on all this estrogen, and months go by, and then all of a sudden the uterus gets thicker and thicker and thicker. Or maybe they're not on the right dose. I did a consult earlier today of somebody who was only on 50 milligrams of topical progesterone. 50 milligrams of topical progesterone has not been shown to protect against any kind of hyperplasia. Now, I will give the caveat of everybody, this is personalized medicine here. So in this case, the doctor said they really struggle, they react really negatively to progesterone, but they seem to be doing well on 50 milligrams of progesterone topically.
Gotcha.
Doesn't fall in the guidelines, not what we'd recommend. And the doctor said, do you think if I had them do an ultrasound every 6 months to a year, I'd be okay? And I was like, yeah, absolutely. Yes, you're doing your due diligence. We're checking the inside of her uterus, and let's see if the 50 milligrams can be enough with all the other work. But it may not. And as long as the patient knows that, then we're all on the same playing field.
Yeah. So when, like you said, you didn't have enough like of their overall care, so you may not be able to fix like what I call the seven pillars, or their lifestyle and sleep and stress management. I'm trying to increase like oxytocin, all those things, um, but you would still say, hey, critically, we need to, as much as we need to find appropriate care in the acute term,
Yeah.
we need to figure out what caused this, what part of our lifestyle, whether it's stress management, boundaries, sleep issues, lots of PCBs from farm fresh, whatever. Like we need
Yeah.
to figure out what we need to clean up.
Yeah.
And then, and here's my question with that. You and I have talked quite extensively on inflammation in regards to endometriosis, all those things, to where they can start to get progesterone resistance. Have
Yes.
you ever noticed where, like we talk about with T3 medications or anything else, where they're so inflamed and they do have all this endometrial tissue, but they're so inflamed that you even give them a synthetic or BH bioidentical replacement therapy, and their body doesn't really respond super great after several weeks because they're so hormone resistant.
Yeah.
Do you ever notice those things? And if so, what
Yeah.
is best to do?
Interestingly, not only do I notice it, but I see it in the comments on social media. I don't know if you've ever noticed where, obviously hormones are all over social media right now, and they're with good reason. And also because there are people are very quick to prescribe hormones. If
Yep.
somebody's going to prescribe hormones, it seems to be very quick and with very little intake other than what's your age, what are your symptoms, risks, and then boom, here's a prescription. Some women do really well. Oh my gosh, I felt amazing, life-changing, thank God for it. Some
Yeah.
women are like, it helped some of my symptoms, but I'm still really struggling. And others are like, hated it. This isn't working. I must not be a candidate for hormones. And I believe strongly that the middle ground and the women who hated it probably really struggle in all of those foundational areas. But that's not conventional medicine's area to shine. And so they're just like, you've got cardiometabolic issues, you're overweight or obese, you're full of inflammation, maybe your detox pathways suck, maybe you use plastic water bottles all day long, spray yourself in perfume and light candles, but they're not asking that. And they're just putting them on all this hormone. And then if you add on that the person is a sensitive bunny, like they're just going to react poorly. So then what happens is they either stop completely or they will self-adjust. They're like, ooh, I'm only going to take, especially if it's a topical, or a capsule, they're like, I'll take half. I'll just skip it today. And then that's what can lead to even more issues with estrogen, the uterus, side effects, things
Yeah.
like that.
Because not only are they so inflamed that they're not able to bind properly with the progesterone that they're on, but that inflammation is just going to further the aromatization and estrogen
Mhm.
accumulation and detox so it goes back to where it's like, hey, honestly, we can't, I always tell people, you can't, I say can't, at least long term, it's not going to be efficient, that you can't biohack the body's system to a certain degree. Like, like we've talked about, if you are in such cell danger response,
Yeah.
like I actually personally went through this with my own thyroid years ago, where I increased my NP thyroid, and when we increased it, my T3 went from a 2.7 down to a 2.5. My body was rejecting it
Yeah.
to
It's like,
reverse T3.
no, stop doing that.
Exactly. You
Yeah.
couldn't biohack it. And
Hmm.
then after I addressed my issues, now I am completely thyroid medication free, and my T3 is a 3.3. It's better than it's
Hmm.
ever been, ever. But that was just because I was like, hey, I do have some trauma. I have some 7 pillar boundary issues that I'm violating, and I need to, and quite frankly, like we discussed before the filming of this, is I had some micronutrient
Yeah.
deficiencies that people don't really consider. Actually, to be honest, you want to know the two things that changed my thyroid numbers, and I have just the labs back to back to prove it. It was whenever I started grounding. That was
Yeah.
when I became a
Yeah.
real big believer in grounding. But I, because I live inland, I'm not by the sea. Naturally, I don't get a lot of iodine or iodide exposure. And
Hmm.
so when I started using iodized salt,
Oh,
my
yeah.
three skyrocketed to a really good level. And I do believe that it was just because, those are the only two things I changed.
You
I
know
had-
what's fascinating about grounding? I call grounding electron tinder. So grounding, for people who don't know, of course, is when you like go outside in a grassy area, put your feet on it in the sand, you're by a waterfall, ocean, river, forest bathing. It's electron tinder. And what I mean by that is your electrons in your body don't like to be single. When they're single, then they become problematic. They become reactive oxygen species or reactive nitrogen species. It's when they're paired up that they're stable.
Mm.
So, and when you have all these single superoxides and, problematic single electrons, that's when you can get overloaded with these reactive oxygen species, right? So your oxidant to antioxidant ratio shifts, unfortunately, in favor of oxidants. You get a lot of damage, a lot of inflammation, a lot of issues with mitochondria in the cell. So then you go to the ocean, you can stand in the sand, you go to a river, you forest bathe, you stand in your grass, and then you pull up the single electrons from the earth, from the electron field created out of the ocean and the waves or a waterfall or the forest or whatever it is. And they can now bind to your single electrons that you have in your body,
I love
calm
that.
them down, put a ring on it, and then you don't have as much of all of the damage and destruction and inflammation.
Oh man, no, that's so good. No, I think that gives a lot of clarity on a lot of the stuff, especially for women, progesterone, the differences, but also, like we said, hey, with that, you've got to fix your
Mhm.
foundational frameworks of lifestyle. So with that said, when it comes to like testosterone, for women too, I guess we could go for men and women here. Do you ever find a time where you go, hey, I do prefer synthetic testosterone over a bioidentical testosterone? And then also the second question to that is, if you do synthetic, because I actually know most clinics are transferring over from that in my
Yeah.
experience around the country to bioidentical. I really started noticing that about 12 years ago.
Yeah.
But I do know of doctors in Colorado, and the only reason I know this is because I have a client there, where their doctors are in 2023 put my client on synthetic testosterone. And so it's still out there, it's still being a thing. But what does the body need to do to make that more bioavailable and useful to the body? So let's go in order with those two questions. I'd love to hear your thoughts from male or female.
Well, remember for women, we don't have an FDA approved testosterone. So we have to use the men's version or we have to have it compounded. And in either case, we're using the bioidentical. We're not using the synthetic for women at all. And especially if you get it compounded, they're using testosterone. So like the kind in your body or the pro hormone to make testosterone. So it's not even a question for women. It's your version at a small dose or compounded. And then the same for men. I don't think I have ever, not ever in my entire career, prescribed a synthetic testosterone for the men that were on testosterone. They were always 99% of testosterone cypionate.
What are some of the issues or side effects can you get from being on the synthetic testosterone?
You know what's fascinating is that because I've never done it, I've never actually seen the side effects, but I have working at the Dutch test. We would get these men always in the bodybuilding trainer field, and they would have the wildest results, but all their hormones would be off, their cortisol would be off, everything would just look crazy. And I was like, I guarantee you they're on some sort of synthetic anabolic steroid stack,
Wow.
something. And sure enough, I'd either go, if they were a practitioner, I would go back to them or I'd go back to whoever the practitioner was and I'd say, by chance, are they in the bodybuilding field? By chance, are they like a pretty significant trainer, like with some significant gains? And every time it was like, oh, yeah, here's their stack. Like, this is what they're taking. And it would
Yeah.
just show up. And I couldn't even tell you, like, off the top of my head, of like, oh, their testosterone looked like this. It would just be these wild results. And I'm like, what stack are they on? And sure
Yeah.
enough, I was right.
No, that's
And they
well,
usually felt it, right? They felt terrible. They were doing poorly. It's the reason they did hormone testing in the first place.
well, you said I want to actually ask a question on what you just said, but first you had mentioned how we don't have an FDA approved for women for testosterone.
Mm-mm.
So you're using
Yeah.
bioidentical of the male version, but just a lower dose. So my question is like, my thought, okay, would be, yeah, let's give them the lower dose of that. Why do we need a quote unquote version for men versus women? My thought would just be the doses are obviously going to be much different, but why do we need a different version? I guess is you know what I mean? Like what?
Why don't we have one that's FDA approved in the first place?
Right.
So right now, and
Yeah.
which is great. Like we don't have one that's FDA approved, and then as you know, testosterone's tightly controlled. It's
Yeah.
considered a controlled substance. You have to have a DEA license to prescribe it. So not only is the barrier to jump through, you have to have the special license, but then if you go the men's route, then and like what I tell women is picture a ketchup packet from a fast food restaurant. That is what the testosterone packet looks like. And now I'm going to tell you, use a fifth of it. Try
Yeah.
using a fifth of a ketchup packet and get the
Yeah.
dose right, right? So women are like a pea size and then it oops, a little bit too much, and so then we end up just like, oh, just compound it so you get exactly what you want. But in the future, my guess is these same companies that are making the testosterone for men are just going to take the same, make it pink, and then lower the dose so it's dosed appropriately for women.
No, that just goes into like our former conversations that we've
Yeah.
had offline about like women have to jump through hoops just to brush their teeth in the medical, like it's like,
Yes.
why is this so
Yes.
hard? This is normal for men, but then we say, hey, women, you can't do this, and it's like the doctor that said you can't do this is on 4 hormone prescriptions himself, so
Yes,
it doesn't make sense.
yes. It doesn't make sense. And it's the same for, when you go for hormones. And I think there's still a lot of fear because some of the hormones, as we said, are synthetic. So then women send me comments and DMs like, is what I'm on, is that synthetic or is it bioidentical? So if it says estradiol, if it says E2, if it's progesterone, now be careful. If it says medroxyprogesterone acetate, that is synthetic. That is Provera, despite the fact that it says progesterone in the middle of that word. Your actual progesterone on the market is called Prometrium, and it's oral micronized progesterone. So if your prescription says Prometrium or it says oral micronized progesterone, OMP, then that is actually bioidentical. And I know it gets really confusing because then women go, well, I'm on a patch. I do estrogen patches, and estrogen patches are bioidentical. It's an estradiol patch. I'm like, yes, the estradiol patch is bioidentical. The combination patch, the combi patch, if yours says COMBI, combi, that is not bioidentical. It has a progestin in it, which maybe what you need. I don't know. I'm just letting you know the difference because sometimes women go back and read what they have and go, dang it, I asked for hormones, assumed it would be bioidentical, and that's not what I got. Or they're given the synthetic estrogen, they're given Prometrium, and they're thinking they're getting the estradiol capsule.
Yep. No, this is why I wanted to do this, because I was totally amazed at how ignorant people are, not realizing there is such thing as synthetic. And a
Right.
lot of them do get the synthetic, whether it's off the street or, like I said, I even have some clients who their doctors are giving them that. And they think, hey, Nick, I'm on the BHRT that you wanted me to get on or that you recommended or whatever. And I find out, I go, you're on synthetic hormones,
Yeah.
So,
And
but
they sound alike, right? In fact, I actually think I accidentally just said Prometrium when I meant Premarin. Because it's Premarin, Provera. Those are synthetic, but then there's Prometrium, and then people are like, "Well, that sounds synthetic." I'm like, "I know but it's Prometrium is actually progesterone." It sounds like it would be synthetic. I get it. Yeah.
well, so then you had mentioned, with the testosterone that I wanted to ask another question on. So when it came to Dutch, you had said, hey, we'd get these, Dutches and their stuff would be all over the place. Their
Mhm.
cortisol's all over the place. It's all messed up. My two questions on that is this. Can, in your experience, obviously, for the audience, Dr. Carrie was correct me if I'm wrong, the medical director at Dutch for a
Mhm.
decade.
Yep.
So she's, Dutch
Seen a
expert and
few.
master of all things Dutch. And so two things is, number one, because synthetic is a foreign object to the body, it's not bioidentical, can that alone put a stress that will raise cortisol? And the second question is this: if that's the case, if the answer is yes, can anything foreign like breast implants and things like that put such a stress on the body that it raises the cortisol? I only asked that because you said the cortisol could be out of whack, and so I feel like that's an interesting concept to consider.
I would say that I didn't see that. Breast implants is a whole separate category. But for example, the amount of women I saw on the birth control pill or who had a progestin IUD as an example, I definitely couldn't point to their cortisol and go, oh, it's because you're on the pill or it's because you have this IUD. Definitely not. But with breast implants, if somebody actively does have breast implant illness, if they have a mold or an infection that's grown around the capsule of their implant, then yes, that's just like fighting some sort of infection in the body, either at low or high grade, and then that could impact the cortisol results. But
Yeah.
if somebody, I'd say on average, if somebody's doing really well with their implants, no issues, that's usually not the reason for their cortisol. No, but
With
it's
the
but it's hard to
testosterone?
test. Like we can't really test. So yeah, implants is a whole separate category because we still have a
Sure.
whole lot of research to learn about that.
Yeah.
Yeah.
Well, so with the like I only asked because I was thinking like, okay,
Oh,
are
yeah.
hormone, like could those other things be causing the cortisol issues because they're kind of foreign to the body in a way?
I don't think so. I don't think so. But I would argue that again, like if somebody is on a pretty synthetic stack, usually a lot of it utilizes heavy caffeine or some sort of, stimulant that will impact the cortisol. So if somebody is just coming off of stage, they've been on this crazy stack, they do a Dutch test, or maybe they're going on stage. And so they're in the middle of it on a stack that is using caffeine or stimulants as part of their anabolic mix, that will definitely impact the cortisol for sure. But that's its job. Caffeine and stimulants in capsule form will do it.
No, that's very interesting.
But
No, that
most people are not just on a, if you're going to the effort, in my experience, I could be wrong. If you're going to the effort to get a synthetic, like an anabolic steroid, whether it's in the back of the gym, the back of somebody's car, your roommate, you're usually, again, stacking it with other things. You have a desired result with your body. And so you're not just doing one thing, you're usually doing a few things. And that is what's going to mess up cortisol.
yeah, no, that's interesting. So you don't think that any type of, because like we had talked about putting synthetic, it is, the body is going to have to go to a degree of work per se to make this thing do what essentially bioidentical would just do, like that, in the sense of just being very normal to the body. Does that not put any more, or can it, is it possible to put more stress on the body where that type of thing, cortisol being a stress hormone or an energy hormone, I guess you can say, do you not see any relationship that could cause that?
I never saw it.
Yeah, no,
I'm
that's
not saying at a microcellular level, but it's not enough to get picked up on testing. To get picked up on testing, it has to be at a fight or flight situation. It has to be in a big enough response that it's going to move the needle on the HPA axis. A
yeah,
synthetic estrogen that's at a tiny menopausal dose, the body could, like, I'm not saying it doesn't come with side effects. Don't get me wrong. That can have side effects for some women, but moving the needle where the body goes, oh no, fight or flight with prometrium, let me raise adrenaline and turn on all these things, I didn't see. What
yeah.
it could impact at a microcellular level are things like detoxification, which is in some regard, I think, where some of the side effects come in, having to break it down like a medication. But I wouldn't say go on the birth control pill like it equals. If you were on the birth control pill, or if you were on see, I haven't messed myself up, Provera or Premarin, which are synthetic, that's going to equal a fight or flight situation. That's going to drive up this stress response in your body so much so it will show up on any kind of testing. Your
No,
logic is great, but again, like, to move the needle that big.
well, I was going to say, to second what you're saying, I've never seen, out of the hundreds of Dutches that I've seen, obviously you've probably seen tens of thousands, but the hundreds of Dutches that I've seen, any of my clients that, have the breast implants and they've got
Mhm.
this and they've got that and the jacked up cortisol, let's not, like, they're also ones that have radical trauma. They
Yeah,
sleep only 2.5 hours a night. So could
living
those
on
other,
energy drinks. Yeah.
yeah. Could those other things be doing something to the body? Yes, but
Yes.
they're just pushing the body over the cliff that it's already hanging over because of all of your lifestyle issues and the other thing. Those are the things that are really going to be the weightier matters of
Yes.
the cortisol, not the synthetic versus BHRT. It's your sleep is off, you're in a toxic relationship, eat fried food every day and all
Yeah.
these other, those are the, yeah. No, I agree, and I see that all the time.
Yes, for sure. I mean, even from a dietary perspective, I mean, again, like, to move the needle, to get the body to flag like this is a fight or flight situation, I'm going to increase cortisol. Or on the flip side, I'm going to, like, this, it's going to have kicked in to suppress cortisol, that the feedback loop has kicked in. Like, even fried food doesn't do it, right? Like, if you go and eat McDonald's right now, is that a fight or flight situation? Well, maybe it might be for you. Your body might be like, Nick, what are we doing? But for the average person, it's not a fight or flight situation. They're just like,
Sure. No,
right? Like,
for
it's not
sure.
a nervous system issue.
Yeah.
However, poor sleep, for sure, lack of hydration, poor hydration. If you live on McDonald's Cokes, then
Yeah.
yeah, that's probably going to register as an issue with the brain and poor hydration. If you like the other trauma, absolutely. So there, even in the hierarchy of what's kicking off the HPA axis, the nervous system, it, I mean, I hate to say it, but yeah, like, don't eat fried food. I'm not a fan of it, but like that alone, but just as you said, it's a complex situation and it's multifactorial.
No, I mean,
You just
100%.
listed off 10 things. I'm like, yep, together collectively, no
Sure.
wonder you feel terrible. Like, yes.
Yeah, I mean, in my practice, what I've experienced and in my own life is, out of all of my seven pillars, nutrition is actually not the biggest violated one. And I
Hmm.
always tell people that is not really your issue. Like, you eating the cookie cake on Christmas with your family and having the fried whatever,
Mm-hmm.
that's not why we're here. The
Mm-hmm.
biggest issues is their pillar two, which is stress management, community, and environmental toxicity. So they're isolated. They put way too much on their plate. There's no work-life boundaries. It's the whole, they're always in fight or flight.
Right.
And then it's pillar seven, which is sleep.
Yeah.
Those are the two pillars that I find across the board completely. And I always say there's germ theory and there's terrain theory where
Yeah.
people argue every germ that you put in your body, that's the reason I'm jacked up. And I go, I'm sorry, I don't see that exactly. For me, it's terrain. It's is the inflammatory state and nervous system state of your body good? Because if it's good, I can go eat that fried food. And honestly, as long as I don't make it a daily lifestyle, that one thing is not going to change the whole terrain of my body. I still feel pretty good. It's whenever I don't sleep and my stress is really bad that then every germ does count.
Right.
It does hit me differently. So I think that that's kind of what you're saying here,
Yeah.
where it's like, hey, don't go eat the cheesecake every day, but at the same time, let's focus on pillar two and pillar seven. Let's get your oxytocin up, have more,
Yep.
alone time with your spouse, community and laughter. Let's get your sleep right. Let's make life not all about working into the ground and making more money, but more about community and hanging out. Those are the things that I think will dictate how much the other pillars or
Yeah.
violators will really run a toll, whether it's breast implants, food,
Mhm.
any of those other things, right?
And it's even the like when people vilify food. So for example, you and I talk a lot about estrogen detoxification or just detoxification in general. And when
Mhm.
you eat the brassica family of fruit food, the broccoli, the kale, the cauliflower, it eventually in your body will create a compound called DIM, diindolylmethane, which helps appropriate estrogen down the right pathway. But if you're menopausal or you have low levels of estrogen, I don't tend to use DIM. I'm like, ooh, that'll make you too low. In my experience,
Yeah.
anecdotally, let's use something else. Well, what happens then is people will vilify the foods. Carrie said, I can't eat broccoli. Oh, no, Carrie didn't. What Carrie said was the hyper concentrated 300 milligram capsule of this one
Exactly.
ingredient could be an issue. Don't
For sure.
vilify the food, right? But then, I think now what we have is the pendulum is swung in some people quite into orthorexia, where they're
That's
so
what I was going to say.
diligently
Yep.
clean, they're
Yep.
so diligently worried about what they put in their mouth. That is stressing them out. That is
And
worrying them.
that's actually what you taught me with Dutch was the top three reasons that metabolized cortisol was low, especially if you have like a high free cortisol.
Mm-hmm.
It was the T3, the thyroid dynamic,
Yep.
but then the other two were kind of together. It was orthorexia, anorexia. And orthorexia, this is something like my wife is very well balanced now with food. Years ago, she used to have the same mindset of orthorexia, stuff like that, but now she doesn't struggle with that at all. I'm the one that's a little bit more hyper vigilant to a point where we bring it up multiple times a week. She goes, "Hey Nick, you know how you preach to clients this, you're kind of focusing on this a little bit." And I'm like, "No, you're right. The orthorexia, it's such a disease of a
Mm-hmm.
mindset and it's very hard to balance because on one hand you go, well, I think it's good to eat whole foods,
Totally.
but
Totally.
at the same time, every once in a while, once every couple of weeks or something, if our 4-year-old son wants to make some donuts with his new little donut,
Mm-hmm.
molder, we should be able to have one. And sometimes I'll get a little nervous about that, and my wife is over there just like chowing them down, and
You got to
I'm
give
like, no,
yourself grace.
yeah, I think that that's an
Yes.
important thing to discuss and to make more aware to people is orthorexia because I've done quite a bit of research on it since you
Yep.
brought it up to me
Yep.
almost a year ago now, back in April, I think last year, and the literatures and the science on it is completely underestimated and
Y-
how detrimental it is on the body.
yes. Yes. And people, they want the control. And then when things go off the rails out of control, and out of control is a big trigger for the nervous system. So
Yes.
I know we are going to wrap this up, but a girlfriend of mine was in a hotel the other day and she called me and she's like, I've run out of water. She'd brought good water, filtered water with her. And she said, I'm out of water. Do you think I can drink the hotel water? It has fluoride in it. And I was like, yes. I think you've had worse things in your body. You
Yeah.
very rarely drink, you're very good about filtering your water, but she felt the need to call me to verify it's okay to drink the hotel water the next morning because she'd run out of her own water. I was like,
Yeah.
yes, I know it's a tiny bit of fluoride, but now you've got yourself in a nervous system state because you feel out of control.
I was going to say the phone call itself expresses that you're already sympathetic.
Yep. 100%.
That's so good. Oh my
Yep.
God. That's
And
so
let's
good.
be real, as adults, like we've all had worse things in our body. So I was like,
100%.
just drink the water, brush your teeth. It's fine.
Absolutely. Well, no, this has been great, Dr. Carey. As always, my audience always loves to hear a Dr. Carey podcast. So
Thank you, Nick.
thank you for your insight always on hormones and bringing clarity. And one thing I really like is not only clarity, but you are very good at saying, "Hey, what I'm saying here is scientifically backed." And then other times you go, "Hey, what I'm saying here, I'm not finding much science to support it, but
Hmm.
anecdotally, I'm getting radical results with it." And I
Yeah.
think that that's I try to do that to the best of my ability too, where I go, "I'm not
Yes.
finding this in the literature, but I am doing this with myself and clients, and the results are remarkable." And maybe
Yes.
science will come out with the literature in 2028 on it, and we'll look back and go, "Oh man, they were right about something." But I think that that's a super transparent way, which is why I've always loved kind of learning from you on that. Is that you don't over bias things. You just
Hmm.
kind of give the equilibrium of I don't have anything to support this, other than just my results so far. But
Yep.
it's we'll go from there. Or sometimes no, literally go look at the PubMeds. They're actually written there, and go from there.
Yes.
So thank you so much, Dr. Carey. And man, I really look forward to talking with you more. And for the audience, I hope that you enjoyed this episode. If you want any questions, if you need to reach out to Dr. Carey, you'll be able to have that information, her Instagram, her podcast as well, all of those things to be able to reach her and potentially to look at the things that she's speaking at different seminars and things like that in 2026. So stay tuned for the next episode.